Dr. Tom Roselle live right now. 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio on this absolutely gorgeous Sunday afternoon. Give us a call, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you've had in mind. Perhaps you've had a problem, you've tried, you've applied. Well, this is your opportunity to find out how things really can be done without drugs, without surgery. We're here every Sunday trying to give you the cutting-edge information on how you can take control of your life. Remember, your health is a do-it-yourself program, which, by the way, is the title of my book, and you can get that by going to rosellecare.com. Also, the audio version's out. But we're broadcasting today at 105.9 FM, and we would love to take your phone calls. However, we do have a topic, one that intrigues many people, and a tremendous amount of research is being done daily and has been for many, many years, something that comes to us from the eastern portion of the globe, depending on which way you fly, but nevertheless, based in traditional Chinese medicine. We're talking about acupuncture, and the specific area that we're going to talk about today in traditional Chinese medicine is acupuncture in pain management or pain control, how it really works, what can be done, what's the data behind it. It's been a fascinating subject for me. I've been involved in acupuncture as well as chiropractic since I was in school, and I had one of my teachers was what they called a traditional Chinese barefoot doctor, guy who has been imbued in the aspects of traditional Chinese medicine since he was a child, herbs and Pina and acupuncture and all of the things that are associated with it. But our topic today is going to be shared with me by someone who I respect, someone who I think has a tremendous insight in this area, somebody who is a very capable woman, Dr. Stephanie Pina. Dr. Pina, good afternoon.
Good afternoon. I was about to say good morning.
It is. Well, you are awake. I woke you up early, so there's no excuses, except that at 12 o'clock it's very difficult sometimes to distinguish between noon and afternoon. So,
well, thank you for having me.
It's always fun to have you because you're very, very capable. And, if I'm not here, I'd probably give you the microphone and say, run with it because you could do this as well as I can. But let's talk about what you're going to be talking about this Wednesday evening. Dr. Pina is going to be your presenter this Wednesday evening, the 11th of January. God, it's the 11th already. It's amazing. I thought we just started 2012. But it's 7:30 p.m. at the Roselle Center for Healing. Dr. Pina is going to present acupuncture and pain control. How effective is acupuncture in dealing with pain? How effective is acupuncture in assisting other modalities? So let's talk about that, Dr. Pina. Let's talk about the capacity, and many will tell you the long-lasting relief. We're looking at $100 billion industry today relative to disability, pain-reducing drugs, hospitalization, doctor visits, and so forth and so on. It's huge, the amount of money that's being spent just to control pain. And, whether it's a fibromyalgic patient or somebody that has a bad knee or whatever it is, the point of it is that acupuncture, practice in the realm of what we call TCM or traditional Chinese medicine, utilizing manipulation and herbs and so forth, is profound. So let's go from there. In your experience, and you've been in practice quite a while, how effective is acupuncture, and why should it be the primary portal instead of everything else has failed, let's try that?
Well, pain does tend to be the number one thing that brings patients in for acupuncture, whether or not they're receiving it by itself or they're actually using it in combinations with other types of therapies, like maybe it's chiropractic, nutrition, or even conventional, drug medications. And to me, it tends to be very effective depending on how much you can really focus in on the real issue of the problem. Are you really concentrating on where the pain is, or is there other things that are going on? So part of the problem when you look at just pain control from a medication standpoint is just to numb it out. It's not fixing the area. With the acupuncture, what we can do is go in there and really work on improving function in an area, as well as kind of eliminate some of those symptoms that are more acute, and then basically work on helping the body heal itself overall.
Well, let's talk about, clear the air on one thing. With acupuncture, no side effects.
Correct.
There's nothing that's going to be, if acupuncture failed and was totally bad, there's no residual that the patient has to deal with, correct?
Correct.
Okay.
Absolutely.
So in total contrast to using medication. So if you use a medication of any sort, there's always the jeopardy, if you will, that there's a side effect, that it can cause other problems. It can break things down much more rapidly than the problem that you're trying to resolve. So we know that the National Institute of Health is doing research on the effectiveness of acupuncture. You know, when I was in school, I watched open heart surgery. This woman was having open heart bypass surgery. She was on the table, was in a Chinese hospital, and she had 6 acupuncture needles in her, no anesthesia other than acupuncture. That got my attention. The woman was wide awake. She was talking to the doctors as they had her chest open. How is that possible?
Well, essentially what you're doing, unlike when you do a medication, especially in the anesthesia standpoint, where essentially you're trying to not only make it more comfortable for the patients, but then you're also trying not to make them kind of physically there so they know what's going on. With acupuncture, what you're really trying to do is focus on the connection between where the tissues are that you're working on, where that pain's really coming from, and how it's responding to the brain. So essentially, if you're able to kind of modify the response from the brain to the tissues, that's going to help promote feelings of relaxation. It's going to help induce your own endorphins, essentially, to kind of help relieve anything, and then your body isn't going to feel as much as what's going on. So it's interesting with the acupuncture anesthesia, a lot of the research studies that they've been doing now lately has actually been done for post-operational type of pain. But essentially, yeah, in the hospitals in China, they'll actually use it pre-operation, during, and then they'll use a lot of different types of modalities that work best for whatever they're going to do.
There are more and more physicians in this country that are implementing acupuncture-type procedures, dry needling procedures, acupuncture pressure, tapping techniques, and so forth to help control pain patterns, and we've used those forever in our practice. Obviously, we integrate everything that we can possibly integrate to try to get the most effective, long-lasting relief. Obviously, the patient has to participate in some of the things we ask them to do. But let's talk about the premise of acupuncture pain control, if you will. But I want to remind our listeners that this Wednesday evening, the 11th of January at 7:30 p.m., you're going to be our presenter at the Roselle Center for Healing, and you're going to be talking about acupuncture and pain control. If you'd like to attend this very, very interesting and eye-opening presentation, please be our guest and give our office a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Stephanie Pina's presentation this Wednesday evening on acupuncture and pain control. Now, in acupuncture, we look at meridians, channels, the flow of energetics, if you will, from one channel to the other. It's a closed chain. And we talk about balance, and if there's balance in the system, then generally there's no major problems. However, we talk about blockage, and blockage is when the energy is not moving for one reason or the other, and it can be because of a lot of different things, but it can come about because of nutritional problems and injury and anger and kinds of emotional stuff, but it also will produce these profound pain patterns that just don't let go, from neuralgias to migraine headaches to patients who have fibromyalgia, menstrual problems, post-surgical pain, as you were just talking about tennis elbow and so forth. How does that work in? Talk to us about, so many people get confused. What does blockage mean, and how does it produce pain?
Well, blockage is kind of an interesting concept, and a lot of times when I really break it down, I'll use the analogy of there being a dam and a river, and essentially what you have to do is there's going to be problems on both sides of that dam. There's going to be overflow on one side, and then there's going to be not enough water on the opposite side. And essentially the same thing can go in the body. When there's a blockage, whether it's caused by a trauma and there was something that physically, manipulated or the actual tissues there, or it could be, a cholesterol blockage in the arteries. Essentially what it is it's not allowing things to function properly. The nerves, the blood, everything can't pass through properly. So this blockage basically builds up. And so you're going to have problems on both sides of those dams. So what acupuncture is doing is essentially it's kind of trying to tear down that dam so that you can basically get that river flowing properly, and that's going to help alleviate pain.
It's a very interesting application, simply because of the fact I'm continually amazed, and I've been at this for 35 years, and I still use all these procedures, and it doesn't cease to impress me that when the body's working properly and it's in balance and the energetics are moving smoothly, then everything else works the way it's supposed to work. for my understanding, when we're dealing with acupuncture, we're dealing with, in a Western application, we're dealing with the release of things called endorphins. And they have an effect on something called the sympathetic nervous system, which is our fight-flight external system, if you will. You know, the tiger's coming to chase you and eat you. You get to run or you get to fight the tiger. Explain that. How does that do that? How does it begin to stimulate the endorphin releases? Is it known, or is it just something that we observe?
Well, there's a number of different ways it's been looked into in research, and that's one of the big areas that essentially research is looking at now. We want to be able to explain it a little bit more in terms of our conventional medicine theories. What we do know, first of all, is as soon as you stimulate something, whether it's through a trauma or even the insertion of a needle, your body's going to respond to it. It's going to say, there's something different here. And as soon as it does that, it tries to figure out, do I need to bring blood flow to this area, or do I need to burn away? Is it a good thing for me, or is it a bad thing? And by doing that, you're essentially able to adjust different chemical controls within the body, all the way from the spinal cord all the way up to the brain, where essentially some of these endorphins, our natural endorphins, are being relaxed and released. And essentially what it's doing is it's allowing the tissues to basically talk to each other. So the acupuncture itself is just a mechanism. That needle itself is just a tool that's helping kind of draw attention to the area where we want to treat and improve function at.
Almost like an antenna.
Exactly.
So if you put the antenna up and you want energetics to move towards it, or if you want to transmit and take energy away from it, that's basically, in a very simple term, what the acupuncture needle is doing.
Exactly, because we know also that some forms of pain are actually like red flags. They're saying there's a problem in this part of the body that you need to address, and it's a symptom and a sign that says, hey, there's something wrong with here. Maybe you don't feel it underneath or you don't see it, but there's something going on here. So it's doing the same thing. It's drawing attention, saying, hey, there's something wrong here. We need to address it. And that way it can also help decrease some of the pain symptoms and the chemicals involved with it, too.
It's incredible that a patient will come in and they're in tremendous amount of pain, and we open up, if you will, the flow of energetics, and then we go directly to the pain site, and almost immediately, sometimes within an hour or so, the patient has tremendous resolution of the pain pattern, and the effectiveness is incredible. When a patient says, well, I have to take this medication, no, you don't. There's ways of doing that. Now, here's a quick question before we come up to a break, is if a patient's on medication, can acupuncture be effective while they're on the medication, or do they have to stop the medication?
Well, some of the studies that have been out there have shown that it is as effective as some of the mild to moderate pain medications. When you're talking about severe pain, you can use it alongside with it, and it can actually help out with the response. The idea when you're working with severe pain patients is you want to see what their goal is. Is it just to increase function? Is it just so they don't feel any pain? And if so, if they're looking at the medications, you want to know what type of pain they're actually in when they're not on medication. But you don't want to just stop them completely. So essentially you come to work with the patient. You want to actually work with whoever's also providing the medications to see how they're actually doing and kind of monitor them as well.
My guest in studio, Dr. Stephanie Pina. We are talking about acupuncture and pain control, the effectiveness of it blocking your pain pattern, and how it can add to the resolution of all the other things that you're doing. This Wednesday evening, the 11th of January at 7:30 p.m., Dr. Pina will be your presenter at the Roselle Center for Healing. Call us at 703-698-7117. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here waiting for your phone calls. 888-630-9625. That's 888-630. WMAL. Love to talk to you on any subject you have in your mind. We are talking about acupuncture and pain control. My guest in studio, Dr. Stephanie Pina, who will be your host this Wednesday evening, the 11th, at 7:30 p.m. at the Roselle Center for Healing. If you'd like to attend Dr. Pina's presentation on how acupuncture can control your pain and the effectiveness and all the data that's supportive behind it, those of you who've heard Dr. Pina before know she's amazing. Call my office, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend this Wednesday evening, the 11th presentation, Dr. Pina's presentation on acupuncture and pain control. We're going to go to the phones because we have some people who are waiting. Steve, thank you for calling. How can I help you, sir?
Thanks, Doctor. Yes, I'm a teacher, and I have two juniors, 16 years old, who have had recent bouts of both mono and Lyme disease at the same time. and both of them have been having trouble. Their doctors, I've talked with their parents, and their doctors have said that their immune systems have been giving them trouble. And I was wondering how you approach Lyme disease.
Okay, obviously Lyme's is an infection with a microorganism called Babesia, and it's one of those things, Steve, that some people are exposed to Lyme's and never have a problem. Some people have exposures to HIV, never get it. Some people have exposures to all kinds of things and never show up. And then some people have an exposure, and not only do they have a problem, but they have a profound problem. The medical approach is to go after it with antibiotic therapy, and it doesn't seem to resolve the problem totally. And if one person in the family has Lyme's, by the way, it begins to go through the entire family, because we know that it will transmit the organism will go through saliva and so forth. Now, having said that, what you're dealing with is how do you get the body to kick in to go after this thing that has a tendency to hide in neurological synapses and into tissue, and it just seems to be unresponsive. You have to go after the immune response. You have to go after the body's ability to help you fight it. I mean, there's a lot of herbs. There's acupuncture pathways that can be utilized. We use low-energy light laser where we stimulate the cells to respond and go after the microorganisms. That can be set on specific Hertz levels. You can use ionization therapy where you can actually begin to pull some of the stuff out in combination. The more things that you use, herbs, homeopathics, what a lot of people are finding on Lyme's is a profound depletion. People who are suffering dramatically of profound depletion of the immune response. Dr. Pina, you want to add to this a little bit? And from a TCM point of view, what takes place, and not so much that, but what can people do? And I'm going to add a couple things after you go through it a little bit. Sure.
Exactly. The immune response is the main key on this, and essentially what you're really trying to do is kind of boost it. And that's why when people have exposures to this, where you said you had two juniors, essentially they might respond completely different. So one body response might be, well, both of their immune systems are low, but someone gets more muscle cramps and someone gets more of the neurological symptoms. What you basically want to do is you want to basically boost the body's own system. You want to boost it through, improving digestion as well, too, because anytime they're doing large doses of antibiotics the way they do in conventional medicine, that's going to tear apart the digestive tract as well. And that in itself is one of the places that basically helps produce the immune system. We have immune factors in the gut that we need that are responsible for the body. So you can work on it from a couple of different ways, but essentially everyone responds a little different. So Chinese medicine really sits down and says, how do you boost the immune system and also treat everything else that's going on with that particular individual?
Steve, when you're dealing with a patient, it's important to find out what their history is. The system could be depleted because of heavy metal toxicity. It could be cofactors, parasite involvement in the body. There could be other viral elements, and you have to begin to go after the entire body. You can't just take care of one thing. In the later stages of Lyme's, where you see the real devastating problems of polyneuropathies and encephalitis and cardiac problems, you're at a place where the body's immune system has really begun to shut down, and you have to step back, take a look, how do we begin to rebuild that system? So it's different for each person, but you have to look at all the different exposures, where they lived, the things that have happened to them beforehand, inoculations, which anybody that's listened to me for a long time knows that I'm against for the most part. When you look at the HGE and the Bartonella and the Babesia and the HME that are part of this whole Lyme's pattern, and the fact that they're carried by a tick, and we think today that the infection comes from many different areas, those buggers have been out there. So what is it about our immune system that's failing? There are things like propolis and lomadium and Woltheria. Those are all things that we use in fighting, as well as the other things that we talked about earlier. You can tell the parents of your students, if they would like to contact me off air, I'd be more than happy to talk to them. You can tell them to contact me through email or by phone, and I'll try to give them more specific information based on their particular case. I know it's confusing. I could probably spend the rest of the program talking about it.
Sure. Yeah. Thanks very much. Both guys are athletes and really good students, and both have been really struggling with fatigue. And so, obviously that's going to manifest itself. So I just wanted to get your view on the thing, and I'll pass that information on to him. Thanks a lot.
Steve, thanks for calling. The fatigue pattern obviously is a fight-flight oxygenation adrenal pathway problem. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here to take your phone calls at 888-630-9625. 888-630-WMAL. Love to talk to you on any subject that you have in mind. We're talking about acupuncture and pain control. More specifically, this half, we're going to talk about acupuncture and arthritis pain. And if you've had the problem or you have the problem and you're on all types of medications, well, there's a lot that can be done, and acupuncture is a piece of it. We're going to talk about that. Want to remind you that this Wednesday evening, Dr. Stephanie Pina will be your presenter, your host, at the Roselle Center for Healing. She's going to be talking about acupuncture and pain control. If you'd like to attend that presentation, give our office a call at 703-698-7117. That's 703-698-7117. 7:30 p.m. Wednesday evening, the 11th. Please be our guest. We do need a reservation, although it's no cost to you. We only have limited space, and when it's filled, it's filled. Thermography Centers of Fairfax is going to continue its special offer, and only Thermography Centers of Fairfax, not Thermography Centers of Maryland and the other offices, but specifically the Fairfax office. For the month of January only, a normal full-body thermographic imaging, $475, they are going to give it to you for $400. So you can start your year out the best way possible, knowing whether or not you have the underlying stages of some nasty pathological problems, particularly breast cancers and vascular disease and so forth. If you'd like to make an appointment, go online and go to thermographycenters.com, click the Fairfax office, and schedule an appointment. You can call them, check their phone number there at 703-943-7248, 703-943-7248. January only, $475 full body scan for $400. Give them a call. Dr. Pina, let's talk a little bit more, but let's talk specifically about arthritic pain. Arthritis is a devastating condition. It's the degeneration of joint spaces. Itis means inflammation. And when there's something that's inflamed, something is usually very painful. There's an arthrosis, by the way, distinguishing feature between the two, which means that the joint is broken down, but the inflammatory level is not present at that point. So it can go from arthrosis to arthritis, back and forth, back and forth. Nevertheless, we got a problem. Patient says, or doc says to the patient, you got arthritis. Let's talk about acupuncture and its application. How effective is acupuncture in treating arthritis?
Well, it's amazing because some of the first resource things that they've done out there in studies basically were on osteoarthritis, especially on osteoarthritis in the knee, and whether or not it works and how it works. And essentially what they noticed is that local treatments actually around the knee, whether or not it's just with the needles or with the electric stim, has been able to first decrease that inflammation. So when that inflammation really gets into that joint space, that's where you start to feel the pain. That's where you might feel heat and have some swelling. So what we want to do first with the acupuncture is it's going to improve blood flow to the area. So essentially what it's doing is helping get the good nutrients into the area and the bad stuff out, which is causing the inflammation. That in itself is going to help also bring some of those factors, those and opioids and stuff in there that essentially are going to help decrease pain and help improve the function of the entire joint itself too.
Now you're stimulating the production, we're going back to what we talked about in the first half, endorphins. And the endorphins are this feel-good opiate type of drug that our bodies produce. And so we're not adding anything to the body, we're just getting our body to do what it should on a natural basis. And so when the patient has this problem, so here's the important, but we know, and we've seen it literally thousands of times over 35 years of practice, where we use acupuncture in conjunction with other things, and the patient's arthritic pain dramatically gets better. And gets better within a reasonable period of time, and then it's a matter of resolution. My question to you is this: with acupuncture, can it not only resolve the pain, but it can begin to restore the joint itself?
There are issues where essentially you can help to improve some of the blood flow in there, so that's going to help to basically bring some of the nutrients and stuff that can help the almost like protective stuff that's inside the joints as well, whether it's in the back, and you can help to with the disc spaces in there, or you can also help with essentially decreasing some of the wear and tear that you're kind of feeling with the pain as well.
It's amazing because obviously we deal with joints in our practice. We deal with a lot of degenerative diseases, and when we see the application of acupuncture and we see the before and afters, and even in rheumatoid, can you distinguish acupuncture application with traditional osteoarthritis and rheumatoid? Do they work the same? Is there a difference?
They would work similar. Essentially, with rheumatoid, you also have to take in the fact that it tends to be an autoimmune type disease. So essentially, the body thinks there's normal tissue there, and it's basically going after that normal tissue. You want to basically also work more on the immune system, because if you don't work on the immune system, you're going to have more of a response. It's going to be a continuation. Versus when you have an osteoarthritis, essentially it's that normal wear and tear of the body. So there may be structural changes, and each one presents a little bit different. Typically, what you want to also do to see with the rheumatoid is what else is going on in the body. It might be affecting other organ systems as well too, and that might be causing some of the pain and inflammation. So you treat them very similar. You want to go after where the specific pain is, but then you also want to look at the other factors that are leading into both of them too, whether it's overuse injuries, normal wear and tear, or if it's the immune system flaring up as well.
Fascinating area in how it affects and enhances other therapies. You know, if you're on medications that are basically NSAIDs, non-steroidal anti-inflammatories, they're causing damage to the joint. They may, in the initial stages, decrease the inflammatory reaction in the body. And by the way, the effectiveness is only short-term. But then it competes for the receptor sites, the areas that you have to get other nutrients into for your body to begin to heal and regenerate the joint. Those are called sulfate ions. So the NSAID gets in and blocks the receptor from the sulfate, so you don't feel the pain, but the pain begins to degenerate even faster. This Wednesday evening, Dr. Pina will be your presenter. Give our office a call, 703-698-7117. Let's go to the phones. Joyce, thank you for calling. How can I help you?
Yes, thank you. I just wanted to make a comment. You're discussing the immune system and these young men who are having a problem that I would urge you, not all doctors, not to overlook the idea of giving a drug test when you find out there's problems with the immune system.
Absolutely.
That's one of the first things that our physician friends in Florida actually formed a group of physicians whose kids were having all kinds of little viruses and illness, and they couldn't figure out what was wrong. They should be the healthiest time in their life. And they decided to try a drug test and found out that all the kids in this little group were involved in marijuana. And marijuana is now 244.2% stronger than it was in the 60s.
Oh, absolutely. Years and years ago, my son, we talked about one time, and it's not because of his involvement, but he said, Dad, he said, years ago, he said, they've become much more refined today compared to what they were. But when you're dealing with immune response in a child, it's not even so much that relative to immune processes, obviously that, whether it's an adult, whether it's a child, whether they're using cocaine, whether they're using other drugs, is going to be a problem that's going to dramatically reduce their immune reaction. But the other things that you need to look at, in my experience over the years, you look at a kid today and their dietary patterns and the things that they're, not only that they're eating that they shouldn't be eating, the sugars, the sodas, the fast foods, the fried foods, the junk that is going to knock their immune system down. But in addition to that, what they're not putting, our foods today are depleted, so you can't even begin to build the body. There was a study on immune function and fighting Lyme's disease that was published about 5 years ago. It came out of La Jolla Institute for Allergy and Immunology, and they talked about the important finding on Lyme's disease that had everything to do with the body's immunological reaction. If the immune system was, now I'm paraphrasing a lot at this point, if the immune system was strong enough, the process of transmission was not susceptible. Also, the progression into the third stages where you're affecting the heart and the brain and so forth did not progress at all, or if it did progress, it was at a very, very low level. So, but they're looking at T cells and the natural killer T cells that were important in supporting body's immunological reaction. If they were suppressed, then the body could not fight properly, and you came down even with a much more devastating end process. But you're right. It's one of the things that we have to look at, and I would never throw a blanket across the board because a lot of kids aren't involved, but many kids are.
We did get a bill passed to allow drug testing in the schools, and all we're saying is not for punishment, but eliminate that first.
I agree. Joyce, thank you very much. You're right on mark.
Enjoy your show.
Thank you. We're here at 888-630-9625. We're talking about acupuncture and pain control. And this Wednesday evening, Dr. Stephanie Pina will be your presenter at our office, 7:30 p.m., the 11th. Give us a call. We'd love to have you as our guest, 703-698-7117. That's 703-698-7117. Dr. Pina, let's talk about TCM, acupuncture, herbal preparations in combination, because I think, in my mind, the profound effectiveness of acupuncture is not acupuncture standalone using the needle. It's acupuncture in conjunction with. Talk to me a little bit about that.
Absolutely. Traditional Chinese medicine tends to make up a couple of different parts, and acupuncture tends to get all the glory on there because that's what you tend to think of. And the Chinese herbals, which can be herbal medicines, it could be vitamins and minerals that are inside plants. Sometimes there's animal products, and sometimes there's other additional trace minerals, are also part of it, as well as there's also dietary aspects of Chinese medicine that are a little bit more basic than some of the things that we would see with a clinical nutritionist. But essentially, there is a dietary part, and there's also a part that involves essentially exercise and massage. It's kind of known as, I call it Chinese medical massage, which is Pina, which essentially is where you kind of go in and find those tender spots and kind of really work them out. But essentially, every single one of those systems are working to improve blood flow and oxygen, to move that qi and that energetic flow between tissues. So any of those symptoms that you come in for say acupuncture, you're really addressing it to see what works best with the patient. Do I need to add herbs? Do I need to look at it from a different perspective? And a lot of the times when you send patients home with, say, I call it homework, it might be those herbs. It might be doing some massage therapy as well at the same time that they can do locally that's going to help their body not only treat whatever symptom they came in for, but also work on their overall health.
Acupuncture in combination. Let me go back a little bit. TCM, traditional Chinese medicine. Again, what you just said, we focus on the needle, and it's not necessarily just the needle. It's about so many different things. It's about natural remedies. The field that I'm in, chiropractic, and my specialty in applied kinesiology, embraces and looks at all those pieces. When we look at something we call the 5 factors, the systems that we look at blood supply, we look at nutrition, we look at the nervous system, we look at the movement of spinal fluid and lymphatic, and we look at acupuncture. When we look at acupuncture, we're looking at the meridian flow, we're looking at the energetic. It's not a matter of looking at the needle. We're looking at how do we manipulate those energies, how do we manipulate the nervous system. The same thing with what we're talking about here when we're talking acupuncture. We're really embracing a much broader application.
Absolutely. It works better within a system, and you have to look at those different areas of the body system. Just like, someone, if they come in with pain in their shoulder, you're not just treating their shoulder. Their shoulder's attached to the rest of their body. So you have to look at the whole system. And when you look at that, you're going to be able to treat more effectively. So using the different areas of traditional Chinese medicine, you're going to be able to come up with more effective treatments for a patient and really be able to individualize it for them as well, too, and then find out what works for them, what kind of things are they doing right now, and what can work for the future. Okay,
that's an interesting presentation. We get a lot of patients that come in, they're athletes, they play golf, they're tennis players, and they have neck, shoulder, arm problems. And we have some people who come in and just all of a sudden they've developed shoulder pain, they don't know why. We talked about history being extremely important when we were addressing one of our callers. Here's the question, okay? Let's talk about shoulder pain, and we're going to talk about an isolated problem. The patient goes to the doctor, well, you have arthritis, or you have bursitis, or you have tendonitis. When we look at it from a pain control point with acupuncture, there's other pieces. The shoulder is the deltoid muscle. The shoulder is the supraspinatus. The shoulder is whatever. So let's say that the patient complains that they can't reach up, and when they reach up, they have pain. From an acupuncture point of view, how would you look at that pain production?
Well, one, even though they're telling you exactly what movement they're doing, you want to actually see where are they actually feeling the pain. When we talked about those meridians, that essentially the connecting points between acupuncture points, there are certain meridians that run into different areas of the body. So you can use which point on those meridians are going to be most effective for them. So someone who has more pain when they're raising their arm is going to be treated differently than someone who, say, when they're flexing their muscles are going to be different. You you also can look at how it connects to the rest of the body too, because we know that some of those meridians that run in that same area actually connect to different types of internal organ systems too. So possibly one of the reasons why they're not repairing as well, they're not responding as well to some of the treatments they've done, or all of a sudden came up, may not even be related to where their shoulder is, but that's where they're feeling it. And we see this a lot with gallbladder issues, where essentially they start talking about having pain in the bottom of their shoulder blade, and it's a referral pain from the actual organ system itself.
One of the interesting presentations that I see with shoulder pain is a patient says, I can't lift in front of me, I can't lift up. It's a deltoid muscle problem at a certain level. If you test the muscle, it's weak. And the relationship that we see is the deltoid is lung function. And what I'll start asking the patient is, one, have you been a smoker? Are you exposed to fumes? Or even something that is more benign that they wouldn't even begin to grasp a hold of is, do you wear cologne or perfume? And that can be a problem, and that can affect the lungs as well.
Absolutely. And also, speaking of what other meridians go in there, you get large intestine, small intestine, and the Sanjiao meridian systems are all in that area too. There are different types of meridians, but essentially there might be something else that's going on. So say there was a minor tear or something, or trauma in there, but essentially they're on one of those poor bad diets and they're eating foods that are going to cause more inflammation. That might be their weak spot. There might have been something there, and now all of a sudden you have to treat their digestive system in order for their shoulder pain to get better. It's not something that we normally think about, but it's all connected. Patients
come in and they say, well, just fix my pain. Well, it's more than just fixing the pain. We can turn the system back on. We can get blood supply to the area. Acupuncture is profound in handling the pain pattern, but there's changes that have to be made as well. Otherwise, it's a recidivistic type of situation. We're going to come up to a break, and there's another call that I want to take, and we're going to take that phone call when we come back. But this Wednesday evening, the 11th of January, 7:30 p.m., Dr. Stephanie Pina will be your host, your presenter at the Roselle Center for Healing. She's going to be talking about acupuncture and pain control. You can give our office a call at 703-698-7117 to schedule and reserve your seat. Don't forget, Thermography Centers of Fairfax is offering you a full-body scan the month of January only, normally $475, $400 during the month of January. Take advantage of it. Start your year out right. Profound diagnostic tool that you need to add to your ongoing personal evaluation. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been broadcasting from 105.9 FM. 888-630-WMAL. Love to talk to you. We have somebody holding. Our guest in studio, Dr. Stephanie Pina, who will be your presenter this Wednesday, the 11th, 7:30 p.m., talking about acupuncture and pain control. If you have any questions, if you'd like to learn more, if you'd like to figure out how it could help you, give our office a call, 703-698-7117. That's 703-698-7117. Rachel, how can I help you?
When I go to my dentist, before I go there, I take amoxicillin because that's what they've asked me to do.
To have what kind of a procedure done?
Well, it would be the hygienist mainly. All
okay.
Right? But when I was in the hospital last August for C. diff, they asked me if I had been on amoxicillin. Is there any connection between the two? I don't have the C. diff now.
You want to jump into this one?
Sure.
I see a smile from ear to ear, so go ahead.
I do. There's some interesting background on this. Typically, even if you're just going in for a dental cleaning, if there's been any risk, especially things like rheumatic fever in the past, any kind of autoimmune disease, they will typically prescribe amoxicillin basically more as a precursor. There's some dentists now that have started to reconsider whether or not that's a good idea, especially when things tend to happen later on, because as soon as you give an antibiotic, it doesn't know where to block the good bacteria and the bad bacteria. In your particular case, too, when you went to the hospital and all of a sudden there's this C. diff exposure, which is obviously a pretty strong bacteria that's in the digestional tract, and it's pretty hard to get rid of. Sometimes when you've had amoxicillin exposures or different types of antibiotics, it kind of gets rid of all that good bacteria, and so essentially it kind of leaves room for all the bad stuff to come in. So when they look at history, just like we do, they want to see what your exposures are. So when a dentist has you do it, it's more of a precursor because they know that it can lead to strep infections that essentially can go straight to the heart, and essentially it can be more deadly to other areas of the body, but they're not looking beyond that.
I have a problem, Rachel, with dentists prophylactically using antibacterials for a lot of reasons. And one, because it significantly drops your immune reaction to other types of things, so you have a greater exposure to things like C. diff.
Yeah, well, I'm supposed to go there on Tuesday, and I don't know what to do now.
Have you ever had a rheumatic problem?
No, but I have had AF in the past.
Okay. So the thing with it is, I can't intervene. You're not my patient. I don't know your health history enough. There are very strong herbs that can be used that are antimicrobial that work even better. But nevertheless, again, I would be broaching that line, and I can't do that. To my own patients, I would make suggestions, and I would say if I is in that position, this is what I would be doing. However, if you don't have a rheumatic problem or a history of that, if you haven't had any kind of situations, dentists sometimes they have to look at their own sterile field and make sure that they're doing the things that they need to be doing to prevent infection. The more we use antibiotics as a prophylactic to try to prevent something, the more we're setting up the stage for immune-resistant problems, and you end up with all kinds of things, including C. diff. That's why you walk into a hospital and you're getting these things. Unfortunately, we've caused ourselves our own problems. I wish I could be much more specific for you on the air. I can't. If you'd like to talk to me offline, send me a note through our website, rosellecare.com. That's ROSELLE. Okay. And
when you were mentioning herbs, what were you talking about?
Well, there's things, even golden seal and bee propolis, and the combination of the two do tremendous jobs. But again, I can't tell you to use those, and I can't. There's many other things. So, anyway, Rachel, thank you. I appreciate it. We're coming up to the end of the program. Give me a call if you would like to have some more information. Dr. Pina, thank you. You're going to present this Wednesday evening at 11 or the 11th. This is Dr. Tom Roselle. I'll be here next week and every week, bringing you the most up-to-date information as we possibly can. See you then. Bye.